Welcome to Part 3 of the Practice Management Secrets series for the iAct course. I'm your host, Paul Speziali, and today I have as my guest Dr. Don Foster, owner of one of the biggest practices in Canada at $500K a month and 40% overhead. Welcome, Dr. Foster.
Thanks. Glad to be here. Please call me Don.
Sure. All right, Don. To start off, if you don't mind, first I'd like to go over with you the number one secret to achieving that, as well as what some of the doctors and their staff attending will get out of your part in the iAct course.
Okay, that's fine.
Great. Okay, so a lot of people are asking me, how does Don do it? How does he create and sustain a low-overhead, multi-million-dollar single practice, especially in a city where there's high unemployment? So if you had to pick one thing that made the biggest difference, one thing that led to the most improvement in the shortest time, the quote-unquote magic bullet dentists are always looking for, what would it be?
Paul, that's an easy question to answer. It's customer service that exceeds expectation. It's something that is not talked about in dentistry. It's talked about in industry, in many other service industries, but not in dentistry. And if you're going to ask me my magic bullet, that would be it. That's what gets people coming in the door.
That's interesting that you would say that. Why do you think that they don't talk about it in dentistry?
Because I think we're technique-oriented. We deal with our hands, and we have the pressure of time restrictions. We have quality concerns, management of a dental practice. I think the customer service part of it is overlooked.
Fascinating. Well, that should be interesting to go over, and you would be going over this in detail at the course, correct?
I think I've got great stuff on this. And it's something that I love talking about.
Well, perfect. That sounds great. Okay, now it's your turn to answer this question I asked both Dr. McDonald and Dr. Bond, is why hold the course? What made you interested in the first place to teach others your methods?
You know, I've known Rob and Al for a long time. I'm a graduate of their Canadian Straight Wire course, and they are totally dedicated to teaching people what they know. And I was totally flattered that they asked me to join their team. And it's a giving sort of situation, and I'm really having fun doing this, and I'm, again, flattered that they asked me.
Excellent. That's fantastic. So what kind of benefits do you hope to impart onto the students, dentists, and their office while you give your talk, part of the talk?
What the benefits would be? Well, I'm hoping to show them things that they haven't seen before. I know I'm going to show them things they haven't seen before. We have a tracking system with a business tracking system that I think second to none. It lets you know exactly where you are all the time. And then we have a large section on our customer service module and how we handle it, and it's endless. The number of things you can do to attract and keep people. I think it's really good.
Excellent. Excellent. Very good. So now, if you don't mind, I'd just like to go through some of the bullet points on your portion of the iAct brochure, just to give the listeners a little bit more of a taste.
Yep.
Okay, so you mentioned that just briefly, but the title is Everything Monitored Gets Improved. So the 8 advantages of practice monitoring.
Well, this is the business part. Everything monitored gets improved, and then the 8 advantages of practice monitoring. We monitor, we will be discussing a dozen different things that we monitor, mostly percentages. What the percentages of, for example, staff overhead. What is an acceptable number for that? What's an acceptable number for the percentage of your gross that's sundries? And how do you keep track of it? And there's 12 of them that we're going to go through and talk about each one and what would be an acceptable number to have if you're running a good dental practice.
Okay. And the next one is analysis and benefits of business variables that require monitoring.
Well, that's what I was just talking about. Yep. There's about 12 of them, and we're going to go through each one of them.
Excellent. Okay, and then the next one is examine 3 profit centers: associate, special associate, and general anesthetic.
We have a routine that we go through to monitor the entire practice. And we monitor all our expenses, all our production, and we put it together in a form that we can understand and look at and figure it out immediately. We apply that exact same formula to any associates that we have. We apply it to our general anesthetic department, and we had a specialist associate that worked with us. It was an endodontist, and same formula was plugged into her business just to be sure that we were on track and doing it right.
Excellent. And then the next one is the secret to making it happen, the 3 C's of customer service: care, convenience, commitment to quality.
Well, this is the customer service that exceeds expectation department. I think that every industry has a customer service module that they have to. For example, if you had a courier service, your customer service module would be it'd be quick, it would be courteous, and be dependable. That would be 3 things. In dentistry, I think it's care. People don't care how much you know till they know how much you care. The convenience. I think that the 9 to 5 dental practice is over. Now, we should be looking way beyond that as far as our hours are concerned and our convenience. And commitment to quality is pretty well self-explanatory.
Mm-hmm. Excellent. And then the next one is value of continuing education: tools in the bag, products on the shelf.
Dentists give away general practicing dentists give away way too much. The educational opportunities now are better than ever. You can get trained in anything. And when we had our endodontist here, it was amazing the number of general practitioners that referred routine endodontic work to her, and it was treatments that they were totally capable of doing. And I'm going to discuss not only endodontics, but periodontics and all the specialties. The opportunities are immense for doing that kind of work.
Excellent, excellent. And the final one is effective promotions, both internal and external.
This is interesting. I do not think that you should engage in external promotions until inside is in good shape. Until your staff are courteous and friendly, until your dentists are painless and efficient. There are so many things that can go on inside your office that have to be taken care of. What's the point of external promotions if inside isn't in good shape?
That's a good point. That's a good point. Save a lot of money that way.
Yeah.
Excellent. Okay, great. And thank you for taking the time to go through that for everyone.
My pleasure.
But for those that want to register for the course, how could they do that?
Well, all they have to do is go to www.dental-profits.com, dental-profits.com, and click courses. And then they can click on the Register Now button.
Great. Thank you very much, Don. It was a pleasure speaking with you.
Well, thank you. My pleasure, too. Bye.
All right. Join us for the other parts of the Practice Management Secret series for the iAct course. We have Dr. Rob Bond on new patient attraction and retention, Dr. Alan McDonald on secrets of the business side of dentistry, and Sean Bayless on effective staff management.